take your glucose reading at home. Have your supplies nearby before we get started. For the purpose of this video, we are going to use the Rely On glucose meter to take our glucose reading. Inside your carrying bag, you will have your Rely On meter. And this is where you will put your glucose scripts, your testing scripts. And you also have your scripts come in a little bottle like this. Make sure you check the expiration date before use because they do expire. And you will use a script. And you make sure you insert this part inside of your meter like this. And when you do, it's going to beep. And that blood drop is an indication that it's ready for you to put a sample of your blood right here on the tip to read. And here are some lancet needles. And here is your lancing tool. This is your lancing pen. And you will open your lancing pen. Right here, you'll pull it. And here is where you will insert your lancet. And then you will push it down. And before you cover your lancet, you would like to unscrew this. Don't bend it because you'll bend the needle, but you will gently twist it off. And I will show you how in just a moment. You will get your top and you will hear it snap. Now once you insert your lancet, it's now engaged. And once you press this button, that's when it's going to insert into your fingertip. So be very careful. Okay, I'm gonna leave this uncovered. Like this is the box for the lancet. And in your meter box, you will also have a little handy notebook to help you keep track of your glucose readings. Okay, I'm going to demonstrate on myself so you will know how to properly use it. Make sure before you get started, you complete your hand hygiene by washing your hand in warm water and soap. Okay. I'm inserting the lancet. Is push down, making sure not to press the button. You're going to unscrew this. I don't know if you can see the needle. It's very little. This is a 30 gauge. Make sure not to press the button because the needle is exposed. You're going to cover this until you hit a clamp. Now, depending on your lancet, is going to have different depths on the cover. This is based on how deep you want it to go on your finger. Okay? Use some alcohol. You want to wipe that finger off. Make sure you let it dry. You want to stick the size of the finger because that's where you have more capillaries located. This gauge is on a 5. Once you stick yourself, you're going to wipe off the first blood because it might have residue from the alcohol and it can give a false reading. So you're going to wipe that off, and then that's when you're going to read the second one. Okay? Now this is the clean finger. You're going to insert your tab. Try not to touch the tip. You're going to go to the side. Sting a little bit. You're going to wipe that off. And for some reason my finger is okay. This is a good one. You're going to use your meter. It's going to start to read. And my number is a 97, which is good. And I have not eaten dinner. So you want to wipe this off and you want to hold this. You want to make sure you dispose of this in the trash. Okay, you want to make sure you properly dispose of your needle. Now, when you're getting rid of your needle, you do not want to throw this in a trash can. You want to dispose of this in a biohazard or a sharps container. I will insert a picture of it so you will know what to look for. You can also collect one from your pharmacy, but you do not want to dispose of this in a garbage can. You want to clean up your area. And you also would like to keep this clean as well. You will wash the top, the cover, with warm water and soap. And you will also wipe this down with alcohol, 70% alcohol, to disinfect it.